The C-SPAN networks bring you long-form public affairs programming from the nation's capital and are a public service of your television provider. C-SPAN, created by cable.
Washington, D.C. It's their site of their first ever mHealth Innovation Expo. It's a discussion about the future of health and technology. In this program, you're going to hear from regulators and innovators. Joining us on the communicators at the site of the FCC's mHealth Innovation Expo is Matt Quinn, Director of Healthcare Initiatives for the FCC. Welcome.
Thank you.
Why is the FCC involved in these kind of matters?
We're involved in lots of ways in healthcare and in mobile health. One of the ways that we're involved is that we had a mHealth task force last year say, here are some ways that FCC can provide leadership in this area. We have a equipment certification program, so basically any piece of equipment that uses spectrum as a transmitter, we approve as an agency. The other side is that we allocate spectrum. So spectrum is the oxygen on which mobile devices run, whether they be mobile devices for health or other areas. Mm-hmm. But in a more important sense, we have to collaborate and coordinate with both other federal agencies, but also with the private sector in helping entrepreneurs and innovators get to market.
So let's take those 3 points that you made. Spectrum, we think about it on the cell phone or other technologies. How do these devices depend on it?
Well, in the case of apps that run on cell phones, 3G, 4G network, that's part of that. But there's something called a medical body area network, or M-band. FCC was the first, provided the first country in the world to provide allocated spectrum for medical body area network. This is something that allows monitoring of vital signs without having to have intrusive monitors. It can really be a game changer in terms of tracking people's health and healthcare, and that required allocated spectrum. Another way that we support innovation with spectrum, something called medical micropower networks. And so all of these things have to have a spot on the U.S. spectrum map, or else there's potential for interference with other things that are moving through the air.
So for the spectrum that gets allocated for everyone, cell phones or the like, is there a special section of spectrum just for these type of devices?
Yeah, everything has to have its spot. Some things, for example, Bluetooth and wireless mics and other things are in an area called unlicensed spectrum. So there's no guarantee against interference by the device or the manufacturer. And so you can understand how in healthcare settings this could be a problem. And so having allocated spectrum, for example, for M-bands and other things is more and more important.
So let's turn to the device makers, the app makers. What kind of general technologies are we seeing in this kind of space?
Well, there was just a study that showed that there are nearly 20,000 health-related apps on the marketplace, but that's just one angle into this. In this room, you see a diversity of all sorts of things, everything from wireless gateways and networks to connect medical devices together inside of a hospital, to solutions to connect people to networks, to the whole world of remote monitoring that's coming, to even text or SMS-based apps and tools that are used for example, text for baby.
So they all depend on the spectrum. If an app or a medical device maker depends on spectrum, does that mean they have to come to the FCC to get approval for its use?
Yes, and there are, so if you look at the back of your cell phone, you go inside, there's a little FCC key. If there's not, then I have someone to see you. But everything that's a transmitter of spectrum requires FCC approval. And we have a lab in Baltimore, in Columbia, that runs that, but we also have deputized any number of certification bodies and labs to assist with that. A lot of it's done in the private sector.
Now, does that fall directly under your jurisdiction, or are there others at the FCC that deal with that?
Our Office of Engineering and Technology, led by Julie Knapp, who provided remarks earlier today, is in charge of that really important function, as well as figuring out what the rules of the road are for spectrum.
So anybody who uses or develops an app or develops a technology, uses spectrum, they fall under regulation of the FCC. What's the balance between how much regulation the FCC provides and not wanting to stop innovation amongst private companies?
Well, this was really the focus last summer to this day. we worked with the FDA and the Office of the National Coordinator and a federal advisory committee of really diverse folks, everybody from app developers to medical device manufacturers and in between, to say, what is that good balance between patient safety and spectrum and innovation with not just with mHealth, but with the whole array of health IT. And how do the regulators and other entities that are involved work together so that it is not stifling innovation? The FCC's focus is reducing interference, which is not a very funny joke I made earlier, but FDA is focused on patient safety, and we both have equipment authorization programs for products that use Spectrum. Recently, in August, actually, FDA put out guidance, technical guidance on wireless medical devices. We assisted them and worked with them in putting that technical guidance for folks bringing those products to market, saying you have to go through both processes, but they're for slightly different things. And so, any platform, every app doesn't have to come through us. Mm-hmm. It may or may not have to go through FDA, and they put out guidance on the very narrow set of those that act like medical devices that do. But any platform that's a transmitter needs to come through FCC.
Matt Quinn, when you talk about health information, you have to deal with areas of privacy and security. What's the FCC's role?
That's a very good question. We are not the lead agency in enforcing HIPAA. That's the Office of Civil Rights. We work really closely with the Office of the National Coordinator on the requirements, for example, around electronic health records. But we haven't really staked out a specific statutory role as it comes to health IT.
And HIPAA is?
The Health Insurance Portability and Accountability Act, which is the law of the land for both privacy and security of healthcare, but also for expediting administrative transactions. That was the initial intent.
You talked a lot about working with partners, and you listed some earlier. Talk a little bit about this partnership, and how do you keep from getting in each other's way?
Well, we keep it from getting in each other's way by understanding what we do. My first few months here at FCC, a lot of it has just been explaining. So how is FCC involved in healthcare? Probably the most commonly understood part of where FCC is in healthcare is we subsidize broadband for rural healthcare organizations. Actually, our rural healthcare program and the new Healthcare Connect Fund is a universal service fund for making broadband more affordable, not only for rural healthcare providers, but more and more consortia of rural and urban providers and everybody in between. This really aligns really closely with efforts by Medicare and other folks to connect people in healthcare and exchange health information. Explaining that to them in that context, and for example, how the Healthcare Connect Fund can support their efforts, is a real eye-opener for them. From the regulatory side, I spend every Thursday afternoon at the FDA talking through things. We have regular meetings with our Office of Engineering and Technology, and we did a workshop with them recently. We're going to do some workshops on things like wireless test beds in the future. So it's both a technical conversation, but it's also getting to know people individually and personally conversation.
You brought up the Healthcare Connect Fund, so give us a status report on rural areas across the United States. How equipped are they to handle these new technologies?
Well, there's two sides of it. One of them is healthcare organizations themselves, so the institutions and connecting those. And we're getting a lot of progress on broadband to those folks. There are still some gaps, as Commissioner Clyburn talked about earlier, in getting broadband to people individually, and the FCC has taken some pretty exciting actions in that regard through the other programs. The other is just getting phones in people's hands that need them for underserved, and that's other parts of the Universal Service Fund like Lifeline. And we've seen some pretty exciting partnerships between those the phone companies who provide that service, Medicaid managed care organizations, and app developers like Voxiva and Text for Baby. So the power of mHealth and the power of broadband, getting it into individuals' hands as well as hospitals' hands, are two goals that are related but operate in different ways.
And so the fund provides money for that?
The Healthcare Connect Fund, the Rural Health Program, only subsidizes broadband to healthcare organizations. Other programs are aimed at connecting people and also bringing broadband service actually to rural areas and others. And that's less under my purview.
So you said about meeting with the FDA, being here at the FCC, how often does your job involve telling what's happening in this world to the commissioners and the chairman himself?
The chairwoman was the, or Commissioner Clyburn was the chairwoman until recently. And so I am the person who shares that information along with OET and other folks. It's a new role. This is it was actually the role of Director of Healthcare Initiatives was recommended by the mHealth Task Force, and they said we need somebody to sort of to work externally and collaborate, coordinate, and communicate, but also internally. And so I spend a lot of time just trying to learn what others in the agency are doing, and then thinking about, is there a healthcare context to it, and then bringing it to other agencies that might be interested. So HRSA is part of HHS that deals with rural healthcare. At the HIMSS conference in February, we organized
The HIMSS conference is?
Health Information Management System Society. Everybody knows that. It's a big health IT conference. We're having the first all-day pre-conference symposium on rural health IT, overcoming the challenges and seizing the opportunities. And think about it as a great opportunity for all the government's programs, obvious ones like Office of the National Coordinator and HRSA and Medicare, but also U.S. Department of Agriculture and Veterans Administration and all of these folks to talk about their programs in context, and then have beneficiaries, healthcare organizations or people from that program to say, here's how it actually works.
Joining us at the site of the FCC mHealth Conference and Expo is Kent Dix with Alere Connect. He's the President and Chief Executive Officer. What is Alere Connect?
So Alere Connect is used to be formerly known as MedApps out of Scottsdale, Arizona. We are a remote wireless remote patient monitoring solution to be able to put devices in patients' home to be able to monitor and keep them well and have better outcomes and keep them out of the hospital.
And so these devices depend on the cloud and Spectrum to operate?
They do, and they have, inside of our device I'm going to show you today, they have wireless cellular technology using what's known as M2M technology.
Which is?
It's the kind of technology you find in your car, in your laptop, in the parking meters that are out there, very economical and sending small amount of data to the cloud.
So walk us through a little demonstration of how this technology works.
So the device I'm going to show you first is our Mobile Link device. Now at Alere, we have point-of-care devices like for anticoagulation, for lipids, for A1C. We also do health management as well, health information exchange, analytics, the whole spectrum of care. But this device is an anticoagulation device to do PTINR readings. And typically, a patient that's on Coumadin or warfarin would have to go to their doctor maybe once a week to get a blood reading. My mom does that, to go to her doctor to make sure that her blood thinners are working properly. This device is produced by Alere, called the InRatio 2. It's in about 100,000 patients at home, and then the data goes into this device, and then it can go to our service center, our nursing center, where they can help monitor the patient. If there's a problem, they can alert the patient's cardiologist on this. What we're trying to do, and what we are doing with this device, is now we are connecting it to our Mobile Link, which has M2M cellular technology, which I talked about. It connects via a wire to the device, and then once you take a reading, it'll send it automatically to the cloud using the cellular technology and into a back-end system where it can be monitored.
Like an iPad or some type of device?
Well, I've got this on an iPad, but we've got a system which we call the HealthCom 2 system out here, where you can set thresholds for a patient. There's multiple systems we can put it into, but this is our HealthCom 2 system, which brings it in. It set alerts to be able to go through and say, I want their reading to be between 1 and between 3, and if it gets outside that range, then I want to act upon it. So from an efficiency standpoint, a nurse that's looking at this can go through, and if I'm doing well, then there's really nothing she has to do with me today. But if I'm outside of ranges, then maybe an intervention needs to occur so I don't go into the hospital, so I don't have heavier healthcare costs.
So Kentix, you have another type of technology that they could talk to each other, and it's web-based. What's this device?
So this is our home link. This isn't FDA cleared yet. This is still under FDA review, so we're not selling this device yet. But this is a little bit more of a device to be able to talk to multiple devices around it. Somebody that has comorbidities, right? So scale, blood pressure, pulse oximeter, glucose devices, the type of glucose devices that a patient would have in their house anyway.
So how does it work?
So on this, if we sent this home with a patient and they're like a COPD patient, right? I've got a non-pulse oximeter here that's going to take oxygen saturation. Don't look at my stats because they're actually pretty poor today, right? But if you look at it, it'll go through and start looking. It's going to do a little bit of calculation, say what my oxygen saturation is, what my heart rate is, right? And then when this stops, it's going to send it over to this device. And it's going to, if you just put your speaker here.
Saturation is 94%, and your pulse is 107.
So if you left it alone for right now, it announced it's 94 of 107. If you left it alone, it would actually start asking the patient questions. And depending on what program the patient's in, I've got this in a diabetes program, it's going to start asking questions like, did you take your medication today? Did you exercise today? Has your blood glucose been over 300? Has your blood glucose been below 60? We want to look at those type of behavioral parameters to determine if the patient's having any type of problems and if we need to intervene.
So Kentix, for a company like yours, what do you look from the FCC or other forms of government as far as making this technology available?
Well, we've worked with them for the last 3 or 4 years. We were here when the FDA and the FCC initially handed off between Julius and between Margaret Hamburg to make it easier to be able to get through FDA, so we have the right patient safety, right, to be able to do that with these type of devices, but also from the FCC side to be able to bring the most amount of spectrum to rural and highly rural organizations and areas that are out there to try to get these devices in the patient's hands. And that's what the FCC is doing. They're allowing us to work with additional spectrums. They're allowing us to get things to market quicker through FCC certifications as well. One of the things that we are concerned about is the underserved population, as the chairwoman said this morning. I personally have testified for Veterans Affairs on rural and highly rural activity for veterans. If you are a veteran or any person, any U.S. citizen living in a U.S. area, and it's in a rural area, and it's 3 to 5 hours away from your physician, you're going to tend to exacerbate the disease, make it worse. The next time you present is probably going to maybe be in the hospital, and it's going to be a higher health care cost. So we want to try to put this technology into place to be able to monitor people that are an indigent population, an elderly population, the population, a rural population, the population that is consuming 15% of the healthcare costs that consumes 80%. That's what we want to target to keep them out of the hospital.
Kentix, the President and Chief Executive Officer of Alere Connect, thank you.
Thanks so much. Appreciate it.
The communicators at the set of the mHealth Innovation Expo, sponsored by the FCC, joining us right now, Lygeia Ricciardi, the Director of the Office of Consumer eHealth. What's that title and what do you do?
So I am within the Office of the National Coordinator for Health IT. That's a part of the Department of Health and Human Services, and we focus on helping the health system to transform using information technology. Within that, my specific office is really focused on bringing consumers, patients, caregivers, actual people into this process wherever possible. We believe in empowering people through technology. We believe that consumers to date are really an underutilized resource in improving not only their interactions with the healthcare system, but also their own health. Because really, when you think about it, your health is very much dependent on what happens every day when you're miles away from the healthcare system. The little choices you make about what you eat, whether you exercise, whether to take your medications, not to mention things like when to seek care and where, those are the things that really shape your health over the long term, just as much as those critical interactions where you have surgery or receive a treatment.
Because we're talking about the world of mobile apps and medical devices, and they're portable, What's the consumer sentiment towards that as it stands today? Are they wary of it? Are they trusting of it? How would you gauge that?
Well, so as you know, there's been an immense uptake in use of mobile phones generally and apps, including health apps. I think many people are very interested in using them. I think some folks are having a hard time navigating, knowing which is the right app for me, both because people sometimes have questions about efficacy, like how do I know that this app promises to do what it says it does, but also sometimes folks have questions about privacy and security. So one of the things that my office is working on is providing a model notice for health apps. So, for example, when you go to buy a can of soup, you know how there's that consistent FDA label that lets you look for the things that you're interested in. Some people care about sodium, other people care about sugar or fat. So similarly, we're developing a tool, and we've already done this for personal health records, but we're now expanding it to address other kinds of mobile and non-mobile apps and tools. This can help you say, okay, these folks do not resell my information, or this is how they use it. So that, again, a consumer can help to kind of navigate this newly growing and exploding field.
So if you're developing a standard, is this a requirement then that mobile app makers have to follow this standard?
Right now it's voluntary. It's not a standard per se. It's more of a consumer tool that can be used in a voluntary way. We are certainly going to promote its use. We have several major personal health record vendors who are already using it. But again, since we're revising it to apply more broadly to apps and tools, we're really working with folks in the private sector to adopt it more broadly, because we really think it's to their advantage to be able to help explain to consumers what they do with information. And one of the things that we're doing in the year ahead is we're going to be launching a website which is going to help people find where they can get access to their health information. This ties into something called the Blue Button Initiative, which is about consumers getting direct electronic access to their own health information. So you click this thing, the blue button, here's a picture of a blue button right there, and you can download your health data. And you can do that from a variety of different sources. So it could be from your doctor or your health system, so it might be your medical records, but you could also get it potentially from your health plan. It might include not only information about what, episodes of care you've had, but also what that cost. Similarly, you could go to your pharmacy and pull down information like, okay, these are the medications I took. These are all different sources from which you can pull this blue button data. And what we at ONC are doing is we're going to be launching a website that helps you as an individual say, cool, I want to get my data. How do I know where it's available? Point me toward potential sources, and then also point me toward some apps and tools where I can use it. And this is actually where that tool that I mentioned comes in. We're going to have that on the site so that people can look at these different apps and tools and at least say, well, from a privacy and security angle, how are these different companies using my data?
I was going to ask you about that, because all that information flowing around, if I'm the end user, I'm concerned about who gets access to that and who can look at it.
Right. So once you have it and you in your hands as a consumer, it's now outside the realm of HIPAA protections, and it's up to you to figure out what you do with your information. I think there will be increasingly amazing opportunities to plug it into apps and tools, in addition to doing simple things like just reading over your health record and making sure it's correct. So there are simple things, as well as, sharing it with your doctor. Those things are important. Additionally, though, plugging it into apps and tools so that you can do things like remember to take medications, or maybe enter into a competition with a friend or family member about, exercising more, or managing a certain health indicator, keeping your blood sugar under control, or not eating too many cookies in the holidays, whatever it is. So yeah, we want to give folks guidance on which apps and tools are going to be useful to them.
Because you're concerned about the consumer, do you have to convince those in the federal government, those you work with, on better and clearer ways to communicate to the consumer about what we're doing and about their health information?
I think a lot of folks are increasingly, within the federal government and in the private sector too, realizing that the consumer is this underutilized resource. We're all trying to, these days, reform healthcare, improve healthcare, which means not only, more efficiencies, but better quality care, better healthcare outcomes. The only way we're really going to get there is if we engage consumers more. And a lot of the efforts to reform payment are already working toward that goal, tool. But the point with mHealth is most people now have this tool, a ubiquitous tool in our pockets that can really help us make daily decisions that support those behaviors and those ultimate end goals of better care. So this is like an amazing opportunity that we need to take advantage of to meet our national health goals about healthcare.
So for the Blue Button Initiative or other initiatives, do they get direct consumer input as far as how this thing should run?
So that's interesting. Absolutely, we bring consumers in at many points to think about policy, technology. All of our processes are open and transparent. As one example, one thing that we do is we run challenges for the developer community to encourage them to build consumer tools that use this Blue Button data in a structured way. And there's one that we're showcasing here at the mHealth meeting here at the FCC, which the winner of a challenge that we put out is a company called GenieMD, and it was a challenge that was co-designed with patients. We had patients weighing in on what kinds of apps and tools they'd like to see, but also voting on the outcomes. So absolutely, a big part of what my office does is make sure that that consumer voice and perspective is really represented in everything. I think part of what's interesting and challenging is that part of what we're dealing with here in this consumer engagement arena is really a cultural shift. And that's a change both for consumers themselves and for healthcare providers. Because in the traditional model, it was more the doctor who made the diagnosis and kind of called the shots and said, you should do X, Y, Z in order to meet these goals. And we're really advocating for a more collaborative model in which there's more of a shared decision making about even what the goals are, as well as a sharing of information. And we feel that, particularly enabled by technology, consumers can share a lot of information that it is radically helpful to healthcare providers in making diagnoses or in troubleshooting and figuring out why something isn't working. I'm talking about the growth of things like Fitbits or wireless scales or all kinds of other devices that can help you collect information about your daily life and potentially share it with your providers, which is something that we're just on the cusp of starting to figure out how to make that happen.
Are the providers receptive, or are they concerned about that power leaving their hands?
There you go. Great question. Some are incredibly receptive and innovative. Others are not so sure yet. So it's this process of cultural change, and it's getting, again, some consumers too fully embrace this idea. Others say, you know what, I'd really prefer that my doctor take care of everything for me. But the reality of the healthcare system is you cannot assume that your doctor is coordinating with any other doctors you may be seeing and knows every detail of your life. It doesn't happen. So if you want to make sure that you're getting the best care and you're likely to get the best outcomes, you as an individual need to get involved, and you can use technology to make that easier for you.
Do you have personal health or technology that you use on the health side that you like using, and what would you share, or at least tell others about what you like?
Sure. So a couple things that I mentioned already. I do like trackers like the Jawbone Up or the Fitbit. I've used both. I also have one of those Withing scales that automatically updates your scale wirelessly. It puts your weight on a graph. You can choose to tweet that out, which I do not. But nevertheless, it's nice to know that that's there, particularly over the holiday season, so I can see if things start going in a direction they shouldn't. In terms of just kind of making sense of the information and sharing it, I do have a personal health record, which I keep updated, not just for myself, but really more importantly for my kids, because I'm a mother and I have kids who have allergies to medications and other complicated things, and I'm not going to remember so-and-so had, strep throat in February, took that medication, it didn't work. I've got to write that down, and I've got to have it available on my phone so that when I go into, maybe I don't always go in to see the same pediatrician. I sometimes go into like a Minute Clinic or something, and I've got that info right there. So that's really important to me, as well as some of the kind of general social networks about health that I enjoy experimenting with. Some of the sites that you put out a challenge like, I'm going to floss more, and you sort of like vie against your friends to see if they can also meet their own goals. So, I'm an enthusiastic user personally, yes.
Where do you see this going, mHealth technology, the whole kind of system? Where do you see it in 3 to 5 years?
Hopefully it will be even more widely embraced. I hope where this is going is that there will be a greater flow of information from the traditional healthcare system to consumers and back and forth. Right now I think you have two slightly separate worlds where you've got the traditional doctors, hospitals, etc. They don't necessarily share the information that folks are collecting through these apps and tools. And I think through policies that are increasing EHR adoption, in which we're requiring that consumers be able to view and download their data through Blue Button, we'll get that flow going, hopefully in both directions. So that's one thing I hope, a real knitting together of these worlds.
Lygeia Ricciardi is the Director of the Office of Consumer eHealth for the Office of the National Coordinator. Thank you.
Thank you.
You've been watching The Communicators from the Federal Communications Commission. If you want to watch this program or any others, go to our C-SPAN website at cspan.org.